everyone, and welcome. I'm very happy to introduce the next session of the 2026 People and Planet United Global Health and Purpose Summit, which brings together leaders from across health, technology, and innovation to explore how we can drive better outcomes for both people and the planet. This session is titled, Can AI Improve Global Health Without Trust, Equity, and Accountability? As AI continues to scale across health systems globally, the question is no longer just about innovation, but about how these technologies are deployed and whether they are built in ways that are trusted, equitable, and accountable. I'm Christina Reisch. I'm Vice President and Chief of Staff at Finn Partners, and I'm delighted to be joined by David Lazerson, co-founder and CEO of BRIA, and Professor Jonathan Samet from the Colorado School of Public Health, and, this is about to be announced, Chief Epidemiologist of BRIA. They will be in conversation to explore these questions from both a technology and public health perspective. So with that, I'll turn it over to David and Professor Samet.
Thank you so much, Christina. So maybe I will start with stating the obvious. AI is already moving at full speed in healthcare and in healthcare research. And at this point, the question isn't whether AI should be used. Asking it today is a bit like asking whether computers should be used. The shift has already happened. What's actually quite unusual is who is pushing this forward. In many cases, it's the regulators themselves. Just recently, the FDA announced a pilot where AI will extract data directly from clinical records and submit it to both the FDA and pharmaceutical companies. This came only weeks after another major step, reducing the requirement for a drug approval to a single controlled trial, while combined with AI and real-world data. And at the global level, the World Health Organization has laid out a vision for AI in healthcare, aiming to accelerate evidence-based adoption and to support implementation of AI programs at the country level. So there is a real momentum and real alignment, but at the same time, AI is already creating serious challenges, sometimes from irresponsible use, sometimes from deliberate misuse, and often simply because the underlying technological infrastructure, expertise, and guardrails aren't there yet. And that brings us to the core topic for today. Can AI actually improve global health without trust, without equity, without accountability? So, Professor Samet, may I start with the following question. Who should ultimately be accountable when something goes wrong? And do we need entirely new accountability framework for AI in global health and in healthcare research? There is a growing argument that big AI companies don't and maybe can't take accountability in healthcare because for them it's just another use case. Do you agree with that framing? And what role should global actors like the World Health Organization and other international organizations play in setting and enforcing that accountability?
Well, we're going to talk for a long time about those issues, David, and you've raised some big questions. And of course, let's start first with what do we mean by global health? And are we talking about advancing the health of all countries on the planet, advancing the health of the planet itself? And are we talking about clinical care, medical care, and its relationship with health, or public health more broadly? So we've got a lot of different pieces of this global pie, if you will, to cover. So let's dissect and first think, who are the global actors who could actually make a difference? The World Health Organization, of course, stands out because of its charter and its responsibility and, the broad definition of health that we want to achieve, the state of well-being for all. Then there's national governments. There are the many organizations for health that span countries and continents, similar organizations for public health. There are organizations that cover workers, address children, and so on, as you know. So if we start talking about who should be accountable, it's potentially a very long list, isn't it, as we fill out these different sectors. And I think using those two words, global health, just opens up these not complications, but the challenges that lie ahead and identifying entities that can and will be, and I think those are quite different, um, accountable for how AI is used and not used, which I think is important.
Absolutely. I think that what's maybe a little bit unusual, as I mentioned, is that the regulators are actually pushing AI forward. Usually, they are the ones who are slowing down the innovation for obvious reasons. That's usually their job as the regulators. And now we see that they're really excited about AI. They're excited about what AI can give. So they are pushing it forward, and the AI companies are happy about it. Um but then some critics argue that AI is becoming that the big AI companies are not necessarily there to be accountable, and maybe it's not their job to be the accountable ones.
Yeah.
They say that it's up to you, a researcher or a doctor, to make sure to properly use those tools, those very powerful tools, must say.
So, let's stick with the healthcare sector for the
Yeah.
moment and talk about bringing in AI tools into, you know, I'll say low and middle income countries. I'll use that terminology for now, where AI tools could be very valuable potentially around applying tailored algorithmic care for interpreting diagnostic materials, for scanning handwritten medical records, creating useful data systems, and so on. So, uh, a huge set of potential uses. Downsides, mistakes, tailoring um, tools, AI tools to the local context. So clearly a clinical tool developed, let's say, and tested in New York City, is probably not necessarily going to be applicable in Uganda. Um, but I'll give you an example of how AI might be useful. So 15 years ago, I took a group of students to Uganda. And we went out, we were staying out at a field hospital, a regional hospital. Within 24 hours, it was clear that one of our students had appendicitis. Not a comfortable feeling.
Oh.
Uh, we were able to get somebody in to do an ultrasound. And then the question of interpreting the ultrasound and finding what was there. Well, if you can imagine an AI world, this could have been transmitted off somewhere, read or read on the spot, and come back with a diagnosis. Great. And then the only question would be, what about the accuracy of that tool overall or in that context? And you could continue to think about other circumstances. So, I mean, I think big tech bringing AI tools to small places, which is how this has to work in the end, there has to be some line, some chain of accountability where in steps moving from development to end user application, people know who is responsible and accountable, which is a big word, for for what happens and impact. And again, in the world of AI and global health, people do talk about understanding the impact. And I think that's sort of a global term that means what good has been done and what are the potential risks. And then, of course, there's always who benefits and who could be harmed by things that don't work the way you think they do.
Yes, absolutely. And if I may provide a comparison that I like, when when we look at fields like automotive, where AI now drive your car, it's pretty clear that you will not let ChatGPT to drive your car, because although ChatGPT is a very smart AI, but it will not be accountable. Unlike Tesla, unlike uh, some uh, some AI companies that specialize in driving your car. That's they're all about, and then they are ready to take some accountability on them and not only on you as a driver passenger. If I'm going back to healthcare, ChatGPT can help a lot with healthcare, actually, as is. It's a powerful tool, but it will not take accountability. It's not their job. And then the accountability was always will be with the doctors or the researchers. Eventually, they're responsible for their own treatment and they're responsible for their own studies. But they must work with tools that take some accountability, that understand that they're part of this world, healthcare world that requires a lot of accountability, just like automotive.
So what can you say? So you supposedly would not want to put a car on the street if you were a manufacturer that was prone to explosion, or the navigational system failed and you, the car manufacturer, would be responsible. I mean, if you look down from creation of an AI tool down through its life course, which I think we're still learning about, there'll be
Mhm.
people who purchase it or apply it with certain expectations, certain uses, certain outcomes, all hopefully beneficial, but with potential for risks. And then in the end, in health, we are looking to improve either the health of the individual patient, clinical care, or the health of a population, public health.
Right.
So, if you look down that sequence all along the way, we would like to know what's happening. And perhaps as you go down it, the locus of accountability shifts. So
Mhm.
at the top, the AI manufacturer hopefully is creating something that doesn't have coding errors built in within it or whatever other problems may arise at that point. Moving on down, what if the AI tool doesn't match the application, but it's used anyway? Or there's not an attempt to do quality control and validate the results, making sure they're fit for purpose, if you will. So I think looking down, I can see that the accountability shifts maybe in the end, perhaps to a healthcare provider who makes an AI-driven decision, and perhaps that decision comes out to be wrong for any number of reasons that might happen in that sequence. So I think the answer has to be on accountability. Aren't multiple entities going to be involved in the end or need to be? Not that we've gotten there yet. And we don't have, if you will, accountability police who make sure that, something is happening and that will allow accountability to be maintained or implemented.
So here's maybe a question. Should we have such a police? I mean, as of today, we see kind of contradicting things that happening. On one hand, we see a lot of doctors and researchers starting to use AI tools in an uncontrolled way.
Sure.
And we already see some harm and damage because of this, including invention of not existing diseases and diagnosing patients with those non-existing
Sure.
diseases.
Sure.
So we see this. On the other hand, we also see healthcare organizations that are too conservative and do not adopt AI. And now, if you don't adopt AI, you're already behind and you are not providing the best treatment you can. So maybe there need to be some police, or what do you think?
I think there's going to be multiple domains involved.
Mm-hmm.
And, you could see things, maybe police is the right term, maybe it's the wrong term, but, and because some of this may well move into the regulatory domain.
Right.
And then the question would be if an AI tool is being used for making healthcare decisions, does that need to come under some sort of regulatory authority and by whom? And I think that gets complicated. I mean, you don't put technology into the healthcare technology into the marketplace without going through some sort of approval process. So is this healthcare technology that needs that process? And if so, what would things look like, and what would be done? On the research side, let's say that I have an AI tool that's going to create an analytical data set from millions of records in a healthcare organization. Um, and I'm going to analyze data that have been generated, produce a paper that may have implications for clinical care or public health interventions. There, I think the responsibility for data quality lies with the investigators, the research team, to know that the information they've generated is valid. So, if 30 years ago I sent a field team out to collect data, I had quality control measures and I was responsible personally as an investigator for data quality. I think
Mhm.
now, instead of sending out, a team of 20 field researchers, perhaps sending my AI tool crawling through a complex clinical care database to create my analytical database. I think the investigator there is still accountable. Now, if that investigator has a faulty tool, then then you've moved back up this accountability chain, so-called, that I think we've just kind of defined.
Right. And I think when we talked about this before this meeting, you mentioned that a lot of investigators now are publishing articles that are clearly created by AI. And in this case, I guess responsibility is on the investigators.
Yeah, it's on them, and it's created sort of a new challenge for the peer reviewers and the journals for the entire process of scientific publication. And I think that we're still learning how to grapple with this new challenge. I mean, for the researcher, for someone to use AI to improve the English language to enhance the chances of publication for clarity, that's a good use to turn on AI and say, analyze the data, create the tables, and write the paper, and then I'll put my name on it instead of published by AI. I think that's a different matter.
Absolutely. Well, maybe now then I will slightly pivot from the accountability part to equity part. You mentioned previously that there is a gap or an opportunity with small populations, small places that are not covered by the general healthcare. And I must say that I just recently heard about a tumor board AI that provides, it was ultimately trained as a tumor board. So it provides results and outcomes as good as a consortium of top level oncologists. Now, this can be amazing for small places where you don't have the consortium of the top level
Right.
oncologists, and this tumor board AI can help the local doctors to provide much better care. So AI can close global health gaps, which is amazing. But at the same time, in practice, we also see issues with data bias or infrastructure gaps or unequal access to technology or training how to use it. So do you think AI is more likely to reduce inequality or reinforce it?
Well, I think there's every likelihood that its use obviously will be initially largely with those who can afford it, and whether that's, purchasing a tool or a package for some purpose or implementing, because beyond having whatever it may be, your AI tool to read chest x-rays,
Mhm.
and there's training and implementation to use it. So there's cost along this along using this tool correctly. So
Mhm.
is this a setup for inequity? If we define inequity as those who have more resources getting more and those who have fewer resources getting less. Sure. I mean, isn't that the history of technology and its adaptation? So I think that's a looming issue. It's certainly one that people have written about in the literature and about the potential ethics of inequality that will come and its results. How to deal with this. And it could be that, the needs in a rural hospital, say in sub-Saharan Africa for AI, are obviously quite different from those from, a large Manhattan hospital. And yet in that perhaps rural clinic or rural hospital, AI could make a huge difference for perhaps, you know, creating records that are not handwritten and that are perhaps not retrievable or readily searchable. So there's a real potential need. AI tools for managing clinics or hospitals could make a real real difference. So I think yes, I think inequities are probably inevitable and unavoidable in how some tools get rolled out. And then that said, I would hope, and also in what tools are developed. I mean, are those developing the AI tools, and perhaps some people will, looking at ways to enhance care of childhood pneumonia in sub-Saharan Africa, which might include interpretation of chest X-rays, um, interpretation of physical signs. Even you can imagine having a film of a child in respiratory distress that is then evaluated by an AI agent. So I suspect that people will begin to develop those. They may well be doing it now, and I'm unaware. But I think AI approaches that can benefit health and public health will clearly be rolled out in different ways in different sectors.
So maybe it will resonate with you also as an epidemiologist. It seems like maybe the key for making sure that the AI will promote rather equality than inequality is if we start from public health and research, because if we start there, if we develop our tools to cover more population, if we make sure that when we train this AI, we use data from all types of population and not just Mayo clinics, and
Sure.
Mayo Clinic will excuse me for mentioning them in this regard. The data we use, if we make sure that the data itself is coming from is not biased, it's coming from all different regions. And when we run the research and study and we develop the AI, we think about this, then eventually when the AI will come to treatment, it will be pushing forward equality.
Right, right. So I'm going to use a little thought experiment here to get at this. So let's say somebody gave me $1 billion and
Mhm.
said, use AI to improve health in the world. Um, what would I do? Well, I would probably focus on those places experiencing the greatest disease burden, look at its causes. Our Global Burden of Disease project does that, and then think about where AI could make a difference strategically. And if you were sort of thinking about cost benefit, you would say, where might the greatest benefit come, the return on investment for different problems to which you might apply AI. I think that's the approach I would take with that billion. Now,
Mhm.
the question is, who is going to give that billion and who is going to make the decisions about it and who's going to do that strategic plan, which, of course, we're lacking. But if you went perhaps to the government of some countries that are low resource and said, we want to help advance healthcare and public health and through AI, I think that's the approach that would be taken. So I think we could have some frameworks for decision making to decide where AI could make a difference. And we know where the disease burden comes from and its
Mhm.
causes. I mean, we have good enough picture that we could use the kind of information on disease burden in hand that we have in hand already to help make some guided decisions about what tools, what possibilities might come back and make the most difference, which is really the goal, isn't it? To improve health.
Absolutely. And speaking of this, of a goal of improving health, so some critics argue that AI becoming another technological fix, focusing attention on tools rather than the real underlying political and social determinants of health. Do you think AI is helping us solve the right problems or helping us avoid the harder ones and how can global institutions help ensure we don't fall into this trap?
Well, I think you're sort of um, anthropomorphizing AI, which I don't think we should do.
Mhm.
So I think, I mean, will there be harms? Sure, but I think used the right way. Shouldn't AI be benefiting health overall, public health overall? And we've used the terms global health. I mean, I mean, just as one example, if you move into these broader contexts, some of the broad global sweeping problems, let's say climate change and health. So
Right.
could AI become a useful tool for dealing with some of the consequences of climate change? I mean, let's take wildfires, which are certainly a problem where I live in Colorado and problem in Europe. We've had remarkable wildfires in places we would never have thought, Siberia. Could AI provide enough of a warning system, tools, forecasting that it could be actually predictions could be used in real time or solutions tailored to regions. So I mean I think there's so much potential in the way I see things. Look, 5 years ago, we wouldn't have been having this conversation. And 5 years from now, the conversation will be quite different because, there will have been advances and hopefully some good examples that will allow us to say, yes, here's some successes, here's some triumphs, because I think that's going to be important to get those models in place.
I agree. And also connecting this point to the previous point of equity, I see maybe another angle. One thing that AI does, it democratizes access to research and development. Uh, some types of research and development that previously required huge teams and
Yeah.
were maybe affordable only by the big pharma, and that's it. Now we see suddenly such studies in small biotech companies. Why? Because they can. Because with a smaller team, they can do more, and this means, I believe, that much more study will happen, more small biotech companies, more academic research, and then eventually you will have also more studies on more topics, also covering some niche areas, and maybe you don't need these $1 billion necessary
Yeah.
to,
Yeah.
to get to these areas.
No, I mean let's hope. I mean I totally agree that a future in which massive amounts of money are not needed, there's accessibility, broad accessibility, and um, and accountability would be useful. And I mean, I totally agree that big is not better by any means. And what AI does is it brings its power to enable, one person even to deal with very large bodies of data in ways that we could not do before. So yeah, no, in that sense, I'm optimistic in this conversation. 5 years from now, hopefully, we'll be highlighting some examples.
Let's schedule this conversation from now.
Okay.
Great. Thank you so much, Professor Samet.
No, this has
Thanks.
been a great set of issues to talk about, and I've enjoyed the conversation.